morning and welcome to our latest edition of the Esri National Security Webinar Series. Today's topic is titled Combating the Opioid Epidemic Using GIS. My name is Carl Walter and I'm the Director of Homeland Security Solutions here at Esri, and I'll be facilitating today's webinar. Our speakers today include Chris Schrank and Daniel Hoy from the U.S. Department of Health and Human Services, OIG, Office of Investigations. Joining them are Linda Beal, Dr. Linda Beal. Linda is a lead product engineer on our location analytics team here at Esri. Patrick O'Brien, our public safety solution engineer from Esri. And Kenyon Huber-Wilker, also a solution engineer on our defense intelligence team. I'll go over our agenda in just a minute. I first want to discuss some basic background information on what we will be actually presenting. The opioid response obviously involves participants from many public, private, nonprofit entities and more. We're going to cover a lot in this next hour. We certainly can't cover everything. From a data discussion, a data standpoint, the nature of the response to this problem often involves sensitive law enforcement information as well as protected health data. Both law enforcement and health guard this data very closely, and there are no shortage of laws and policies that govern the use of the data. Terms like HIPAA from the health side and CGIS and LES, law enforcement sensitive, from the law enforcement side are terms commonly used in this arena. That being said, please know that our examples today rely on open source data, number one, investigative examples where data has been totally anonymized, values changed, geography has changed. Sometimes we've shifted it up to 1,000 miles. And then in our third example, we have data that was completely manufactured in order to explain what is a very valid investigative workflow. And we did this to protect some of the investigative tradecraft as well as adhere to the policies around HIPAA and the use of law enforcement sensitive data. With all those potential limitations, let's focus on our objective here today, which is to show how GIS technology can help identify problems, understand and interpret problems, help with response to a problem, evaluate our response to a problem. Did we do what we said we were going to do? How can we do it better? And then finally, very interesting and unique ways to share or disseminate this type of information. We're going to show all of that during subsequent presentations. Our first presenter today is Dr. Linda Beal, and Linda is going to talk about open data, analyzing opioid deaths and other New York City emergency data from their EMS, and talk about some seasonal patterns and differences between heroin and opioid OD trends over time. She's going to do this through a tool we call Insights for ArcGIS, which is a spatial business intelligence tool. And I'm going to turn this over now to Linda and let her begin her presentation.
Thank you, Carl. So I'm going to talk you through Insights a little bit. I'm also going to talk about the analysis kind of as I go. So I'm going to be introducing Insights, which you see here. So this is where we start. We can break down our analysis. This is very much what it's intended for. It's intended for you to be able to carry out kind of exploratory analysis, understand the data, and pull out answers to your questions. We can also obviously get in data sets, we can connect to many different sources, and there are ways, of course, that you can present those results. So let's get started with this opioids analysis, and you'll see what I've done there is I've opened a workbook, and here is where we bring in our data, because obviously in order to do any kind of analysis, we need some data to start with. So you can bring in spatial data that we have here, so you can see I already have a number of different data sources that I have. You can work within groups, so if you want to set up certain people who have access to data sets, you can confine that ability so they can only they can see that data. You may want to share the data across an organization, so for example boundaries might be something you want to share. We also give you access to living atlas layers, which is part of Esri's content. We also, just as a convenience mechanism, allow you to have a lot of boundary data. So for example, for the US, you can see we allow you to see all of the different census variables. This is just a convenience so you can get hold of that spatial data easily. Obviously, you can bring in Excel and CSV files. So let me just bring in a couple of those. I'm just going to drag and drop those in. And we can also connect directly into databases. So if you have a database set up, you can connect to that and bring in that data, be it spatial or non-spatial, to start your analysis. So you'll see I've brought in those data sets just from an Excel file, and let's see how we can start to analyze those. So clicking on the dataset name exposes all of those features that we have within that, all of the information I had within that Excel file. And obviously we can start to do simple things like filtering out the data. So I just wanted to look at this analysis for New York City. And if I just take a couple of these variables, so the total number of deaths by year, and you'll see if I drag those two fields across, I have the option to create a map, a chart, or a table. So straight away I can drop that and I can see the number of deaths that have occurred since 2003 to 2016. I can also break that down by something like sex. And we have a number of different visualizations that we can change any of these cards into. So you'll see now we can see that breakdown. And we're seeing predominantly that males are being affected and that it's been increasing over time. So let's have a look at some of the other data that I have. So I have EMS data, and this is by borough. So I'm going to take all of those pieces of information and create a table from that. So now we're seeing the breakdown by borough, by date. So you see this is very aggregated data that we have. This is for each of the boroughs in New York City and broken down into quarters. So this is open data. This is why it be aggregated so that you can't distinguish any individuals within this data. And we can see this pattern over space and time, but really although the table is giving me the figures, it might make more sense if I can actually see that on the map. So I can easily do that with Insights. I'm going to bring in the boroughs that I have for New York City. And then what I can do is I can go into this. Remember, this was an Excel table that I had, but I'm going to join that to that boroughs data set that I brought in. And you'll see now we have this little icons change that's been added in so that we can see that now this is a shape field. We also have the category of the names, and we have the totals that's shown as a number there. So now I can actually drag that totals across, remembering I can create a map, chart, or a table, and now I can actually spatially see where those are and where I have the greater numbers that are being affected by opioids. I could also have a look at the differences between overdoses that have occurred in terms of the visits to emergency departments. So I'm going to look at the crude rate by borough, and you'll notice if I hover over the chart, I'm given a choice of different options. Now all of these options are led by the type of data you have. So I have categorical data here, I have the number of the names of the boroughs, and also the crude rate. So now I can see that crude rate by each of the boroughs, and I want to compare that. So that's for heroin overdoses. I want to compare that with opioid overdoses. So you'll see if I drop the two over there, that now we can see that both heroin and opioid are actually spatially showing very similar patterns in terms of the crude rates. So what that means is even at this aggregated level of data, I can in fact use sort of the same data. I could use the heroin and the opioid overdoses, and they'll be showing me broadly the same pattern. So depending on the type of data I have, I could use one or the other. Also on the back of all of the cards within Insights, you'll see that we actually report the statistics. So although we saw that they were very similar patterns, you can actually see if we look at the mean and the median of what we have for the heroin, we compare that to what we have for opioids, you'll see that the mean and the median are significantly higher. So there are much higher crude rates that are occurring for the opioids. So that's a very aggregated level of data in both space and time, but we can still start to pick out patterns. But actually looking at EMS calls, which we have at a more disaggregated level, so we have this collected daily data, so this is a very large data set that I've connected to from my database. And you'll see if I expand this, we can already see the total number of calls by zip code. So now we're able to pick out much more of a spatial pattern than we could before. And we can see there are differences within the boroughs that we weren't seeing at an aggregated level. We're also able to create the pattern over time. So now we can see those nuances within the time, and we can see it is gradually increasing over time. And you'll also notice, if I come back to the data pane over here, that we actually break out that data. So this is data that has just one date time field in here. But we've broken out all of those time components, so you can start to answer questions like, is it changing over year on year? Or in this case, I'm going to take this across and create a heat chart, so that now we're seeing the pattern by month and by year to see, are there particular months and years that have more calls, in this case, related to overdoses. And we're seeing indeed there are patterns, and it is getting worse over time. So if we were looking at emergency response, we could break this down even more into the day of the week and the hour, and let's create something like a data clock for that, so that we can see that daily and temporal pattern. Remember, this is aggregating the data from 2013 to 2018, so this is giving us a good statistical sample, and we're able to see that most of these events are occurring in the evening hours, and we're seeing most of them happening on sort of the Friday evening and the Saturday. So we're already getting a good understanding of what's happening there. If we break this down even more and understand the response time within each of these zip code areas, you can start to see again we have a different pattern. And we can also see the travel time that are occurring and the response time. And using the interactivity that's automatically built within Insights, you'll see that I can click on the area of Bronx here, and this is immediately updating that data, both on the charts. I'm seeing a slightly different trend because we're seeing the variables that have been pulled out just for that area, and we can compare that with different areas. It's also useful in some ways because you'll see, as I've clicked on Queens here, that actually there is some data, and this is just the raw data that I've taken, that's actually being miscategorized. So you'll see here as well, you'll see there's one area that's been given the borough name of Staten Island. So if I hadn't have been looking at this spatially, I wouldn't have seen that that data was actually given the wrong piece of information. If I was aggregating that up in tables, giving totals, I'd actually be miscalculating what I was doing, and I'd be actually giving a higher value than I would be expecting from the actual area that I'd be interested in this case, Staten Island. So it can be useful to combine your data both spatially and non-spatially, even if the analysis isn't necessarily at spatial level, but if you're reporting it at those different areas, it's very important to understand those patterns that the data actually may already have within it. So to move on to the next tab I have here, so in this case I'm using something called link analysis within Insights. So again, I've just dragged my variables of interest, and in this case I've created something called a link chart. And what I'm doing is I'm looking at the interactions between, in this case, the dispatch areas and the police precincts that have actually been asked to respond. So if I'm going to click on one of these and you can pull it out, the width of the line in this case is actually showing the response time that's been taken depending on each of the calls. So you can pick out some very interesting patterns. So for example, if I pick on this area here, so this dispatch area, you'll notice that actually the response time in many cases is actually quite long. So there's something going on in terms of this dispatch area, irrespective of the police precinct that they're calling, because if we compare this with other dispatch areas, you'll notice that even at a glance, without me getting the actual values, that you're seeing response time is generally much slower. So you can start to pull out all sorts of different patterns. And one very interesting feature that we have within Insights, if I change this page, so I've been looking at the page view, I'm going to change this to what we call the analysis view, which is essentially showing us that workflow that we've been doing. So if I go back to my very first page, remember I created this from an Excel spreadsheet that I brought in. I had no analysis on that page, and you'll see that everything that I've done on that page has been recorded for me. I have all the details of everything that we actually did. So this is how I actually documented what I've done. If I need to show how I achieved those results, I'm able to show that immediately. It comes as part of the analysis that you're able to share out. And also you're able to use that model again. So not only is it documenting what you want, but if if you need to rerun that same analysis, for example, for a different area,